I was at a clinic the other day with a foster cat. I foster for Cats Haven, and Kitty needed blood work done, and he's an older guy, and they ran a senior panel, and I thought, that's great, and I wonder how many people actually know what's in a senior panel, what the blood work shows, what labs need to be done, and when they need to be done. So with that, I called Tom.
Call Tom.
Bring Tom in.
Sure, so I'm happy to answer those questions, absolutely. So I think the biggest thing we need to understand is these guys can't talk to us, right? So they can't say, you know, when I pee, it hurts right here. So the blood work is an important diagnostic tool, especially as they start getting older, because we can identify little issues before they become really big problems. So whether or not it's blood work that's done on an annual basis, like just a complete blood count and chemistry like we did on both Stewie and Mabel, and we can see here that we've got video running of the actual blood draw. Now I want to point out here real quick that don't be shocked. We often draw blood from a dog's neck. It's a big vein. It's the easiest one to get to, and they tolerate it. As you can see, Stewie was actually shaking hands with Ben right here at that point in time. Now this is a, what we just saw flash up there real quick was a serology test. So that tells us whether or not Stewie has heartworms, whether he's been exposed to tick-borne diseases. So if you're out, you know, hiking with your pet, you may not know if they get a tick. They could get a tick-borne disease, and that test would help us understand that.
All scary stuff. How long does it take to get the results back?
So if your veterinarian has an in-house laboratory, a lot of times you'll have it back within 10, 15, 20 minutes. Now many veterinarians for the panels will send it out to a reference laboratory just because there's probably better quality control a lot of times, and it's more efficient and a little bit less expensive to send it out. But again, in-house, we get it within about 10, 15 minutes, and that's real important during emergency situations.
And it's, Tom, it's not just blood that should be tested for, right?
Right, we could check urine for a lot of things like kidney issues, like things like that. We also, diagnostics include x-rays, ultrasound. Some breeds of dogs are more prone to heart problems, so you may want to do an ultrasound once a year just to make sure they're not developing that.
Could be scary stuff, right, Patty?
Yeah, ask him how they do.
How'd they do?
Oh, how they, you know, they are so wonderful. First of all, they're perfect patients,
Perfect patients.
But we did not see any signs of heartworm. We did not see any signs of tick-borne disease. Their complete blood count, so looking at their red and white blood cells and platelets, were really good. And then their chemistries, so we can look at their liver, their kidneys, glucose levels, other endocrine levels like thyroid. All fine.
But you said for older, you can tell too. Mabel okay?
Mabel's okay. She is such a trooper.